Tonight, in the second part of his Science and Medicine series, Bob Mayer tells us that the greatest hope for epilepsy patients may well be in Gainesville, Florida.
Significant progress has been made at the University of Florida in Gainesville toward determining the cause of one form of epilepsy. Now, doctors here have made an important advance in the search for a treatment that may someday prevent it. Studies here have focused on the kind of epilepsy that frequently develops in humans after head injury or stroke, an affliction suffered by millions of Americans, including 64-year-old John Narrans of Melrose, Florida. Victims of epilepsy often sustain seizures and even unconsciousness. Until now, there has been little hope for cure or prevention. Neurologist Dr. James Wilmore, who also directs the EEG laboratory at Gainesville's VA hospital, has been working on the epilepsy puzzle for years. Wilmore's first breakthrough came 18 months ago when he was able to induce epilepsy in rats by injecting a small amount of iron in their brains. Iron is found naturally in human blood, and Wilmore believes epilepsy is caused when the iron comes into contact with the brain following a head injury where there is internal bleeding. Almost all of Wilmore's animals, between 95 and 100%, develop epilepsy following the iron injections. Now, Wilmore says, he has found a treatment with dramatic effectiveness in preventing the disease from occurring. The answer? Massive doses of vitamin E coupled with a small dose of the mineral selenium. Selenium is administered in the rat's water and the large doses of vitamin E by injections just under the skin. Working together, the two render the iron harmless. Wilmore's studies show that despite injections of iron, only 28% of the rats who got the new treatment developed epilepsy, meaning that the treatment has an effective rate of 72%.
I'm nervous, I'm scared, I'm skeptical, I'm excited. I have a lot of mixed emotions about it. But the most important thing from a scientific point of view is that this provides a clue, it provides information, and that more investigators in independent laboratories need to be asking questions about whether what I've observed is valid, and replicate my experimentation and extend my experimental observations.
If Wilmore's findings are duplicated in human studies, epilepsy prevention treatments may eventually be given to head injury victims on a routine basis. Bob Mayer, Channel 4 News, at the University of Florida, Gainesville.